when your head is facing a direction that the normal people do not face when they die. They would even take you to be buried outside the gates of your homestead.
Hello guys, welcome back. This is our episode 2 of suicide prevention, and before we get direct into the discussion, I'll let my guests introduce themselves, starting from my right.
Hello viewers, I'm Raphael Wambura. I'm a psychiatrist, clinical officer, also the county mental health coordinator.
Hello viewers, I'm Maurice Opetu. I'm a nurse psychiatrist working at the Kisumu County Referral Hospital, the mental health and psychiatric unit. Thank you.
And as we refer back to our theme, which is changing the narrative on suicide, and we'll just focus more on the warning signs, myths and misconceptions, the measures, the way forward of these victims, and so feel free to drop your comments down below, and we'll be able to address those comments in our next episode. So back to you, Daktari. I'll start with this side. So what are some of the warning signs of suicide?
Yes, the warning signs of suicide could be many. We will have to look for maybe change in behavior of somebody we knew. If they started like isolating themselves, they don't want to be around people, they are not attending maybe social gatherings as they were before. They would also like lacking sleep because maybe they are more absorbed into their thoughts, they are not sleeping well. They could also start losing interest with life, losing interest in activities, and even losing interest in things, like they will start giving away their special or prized possessions to others without a reason.
So back to you, what do statistics say about the scope of suicide problems?
Thank you very much. Suicide problems, as you've been told, is associated to problems of mental health and mental problems. And therefore, we have had several cases which many of them have gone uncaptured due to lack of proper attention that was being given to mental health and mental illnesses. Therefore, up to date, it is from scientific studies that around 720,000 people in the whole world are dying by suicide every year. And the age set is between 15 to 29 years of age. And therefore, it is 73% of the global suicide which occurs in low and middle level countries.
According to the statistics, the age group that is mostly affected are the youth. So what are some of the reasons that you think this population is the one mostly affected?
Yeah, as per that population of age sets, you will get that dying by suicide is associated to increased use and misuse of illicit drugs and alcohol or substances. This is the productive age where also one would feel that they should be important in their families, they should be employed, and they should take care of the elderly people, the parents and the families. And therefore, if they lack the income or the sources of income as employment, these people will get into anxiety, depression, and then finally they end up dying by suicide. We also have these people as, especially in the male gender, they tend to want to show that they are male and they are strong people. So some of them attempt to take their lives through very little means to prove that they are brave and they are strong in the society. Given also the increased standards of living that most of people do not reach in the society, you get that this is the age group that will also be dawned upon or down by the stressors of having no occupation, missing to maybe have company. They also end up with breakages of marriages and disconnected families. So this sent them into severe depression, then they die by suicide as complication or as a comorbidity of other mental illnesses.
So back to you, Dr. Why do you think talking about suicide is a bit difficult in our society?
Thank you for that question, Maureen. Talking about suicide could be difficult because of the cultural issues surrounding suicide. In many cultures, it is something that is frowned upon, and even particularly in these regions, there are some rights that maybe if somebody died by suicide, their burial rights and so on are different from somebody who has died from a natural cause. So there's a lot of stigma surrounding suicide, and so people don't openly talk about it and perpetuates the problem.
So you've talked about stigma. Do you think stigma about mental health issues contributes to the increased rates of suicide?
Yeah, that is very true that stigma has contributed a lot to increased numbers of people who die by suicide. We are looking at stigma due to cultural beliefs and stigma due to religious belief. This is in our community, and when it came to somebody taking life by suicide, people never used to discuss it very openly. Also associated to criminalization of dying by suicide, that was also anchored into the constitution, the older constitution, before the reforms were started. Right now, it is lucky enough for us as a nation that we are undergoing a lot of reforms in our constitution, in our laws governing the public health, that is making dying by suicide not a crime. And therefore, people can be able to talk about it openly, and people get more sensitized to mental health and related problems like dying by suicide. So this stigma is getting slowly reduced. Under cultural beliefs and taboos, we talk about suicide as being caused by curse or curses. When somebody fails to appease the dead or the ancestors. So this was very much associated with dying by suicide. And therefore, people never thought that it could be a problem that is related to health or mental health and could be treated. Another stigmatization was that people thought it was as a result of some punishment from the gods, or some punishment of committing a taboo in the society, like when somebody loses a husband, or when you have a disabled person in the family, and therefore you didn't give that person good burial and ceremony for send-off. This person will turn back against the family or the community and take one person by suicide. Then the other thing was that it was believed to be a bad blood that is running in the lineage of a family. And therefore, when you die by suicide, they'll say this originated from that bad blood. Then when we come to issues of religious belief, there are some traditional religion, like Nomia and others, that still believe that when you die by suicide or when you attempt suicide, you are possessed by demons. And therefore, you could not be taken to the hospital and get medical care and get mental health services. Some would also think that it is a sorcery. Somebody has bewitched you, and therefore you could not be treated, and it is beyond any kind of treatment. Therefore, you would be left to deal with your suicidal attempts, suicidal ideations, and you would be left to die, and nobody will talk about you. Then you'll be given a burial that is extraordinary, that is abnormal in the community. You would even be buried when your head is facing a direction that the normal people do not face when they die. They would even take you to be buried outside the gates of your homestead. If you died by hanging yourself, that tree where you hanged yourself or the house where you hanged yourself would be burnt down. The tree would be uprooted, and they make sure it is totally burnt down. And this scared the people, the community around, and would not even attempt talking or discussing about suicide as being a taboo. So this also made it very difficult for mental health practices or intake, especially that is dealing with dying by suicide.
So I've seen Daktari agreeing with you with some of the taboos. So maybe Daktari, you can just give us some of the myths and misconceptions that are related to suicide.
Myths and misconceptions related to suicide. They would say that if somebody died, if someone died by suicide, then they are cursed, or the whole family is cursed, and so it like creates a problem in the society, because they will not be able to understand maybe the real cause of this suicide. Maybe it's because of a mental illness, but then it will be taken as a myth or as a curse. Yes.
So
just to add on, in some circumstances, it would be believed that you are attempting or dying by suicide because you committed a crime like stealing from certain people, people who are believed in the society to be having powers that others do not have. Like there is a time in 2017 where looting was done around the towns, and it was believed that some of the people who committed the crime by looting from some tribe or some particular individuals around our towns had to commit suicide because they stole from people who should not be stolen from, people who have some powers. So you will not see people helping you or supporting you to take you for medical attention, but they would still bother you and traumatize you by asking you to reveal to them whom you stole from or the person you did a bad thing to. Yes.
So from both of you, we've got the point where some people believe that it's a curse for the whole it's a generational curse that your great grandfather died because of suicide, so it's a cycle that continues in the family. So some communities believe that. But do we have any biological evidences or researches that shows that when your grandfather dies because of suicide, you will also die because of that, and maybe another member of the family will be also a victim? Do we have some research around that, or it's just a myth?
Just to take on that, there are researches that have been done in our society and in our community, but they are not actually proving any taboo or any cultural belief. Research relate these deaths and attempts to mental disorders. And the mental disorders were not given much attention before. So scientific proofs have been out and is relating dying by suicide, suicidal attempts, suicidal ideations to mental illness and related problems. Yes.
So we've talked about all these taboos and how the community perceives suicide. So do you think our healthcare providers are doing enough to evaluate the stigma and help these people who have suicidal attempts?
Yes, our health workers are really trying, but there's still some gaps, especially in identification of common mental disorders. And as we saw earlier, most of these suicides are related to mental illnesses. So if healthcare workers could be empowered to identify and treat mental illnesses earlier, then it would help a great deal. Now there is, with the launch of the guidelines for treatment of common mental health disorders, if it is disseminated to the lowest level facilities, then we'll get some good results.
Back to you, how would you help someone who has suicidal thoughts?
First, we have to appreciate that generally we have to create awareness in the society, in schools, in our families, in health facilities where many of our community members visit with different problems. By that, we sensitize the society on seeking or health seeking practice, so that in case of this, they see symptoms and signs of somebody intending to commit suicide or has symptoms of depression as one of the major causes related to suicide, they seek health services. The other measure is creating a strong family bonds and strong family support system to people with mental health problems and people with suicidal ideations and attempts, so that they feel that they have people they belong to and who support them. They also, at our levels in the clinical setups, we help them through multi-professional approach, where we have the physicians to take care of any physical illness. We have psychologists and social counselors to take care of psychological problems, and we have the psychiatrists to assess and treat any other symptoms that is threatening and that may make somebody repeatedly thinking about dying. In that case, we make them to identify the stressors and build a strong coping mechanisms and problem solving. We also have to ensure that we reduce access to lethal tools and means of dying. We have seen that police officers who are professionals that have access, common access to guns, take their lives not by any other means, but mostly by using their guns. We have seen cases where children, people who are under the age of 16, commit suicide by hanging, because that is what they hear from repeated stories. That is what they have even heard, some of them from their family members who have died by suicide. So we reduce access to such things. Like Dr. had mentioned, bioorganic chemicals that are used in our agricultural setups and in our families where we keep livestock. Then we also have to demystify the myths and beliefs that are related to culture and religion, so that we promote the cultural and religious belief that promote prevention of mental illness and suicide. Yes.
So back to you, Dr. So this question is a bit, should I say personal, or yeah, let me say it. So I come to you, Dr. and I tell you I want to die of suicide, like I want to hang myself. How will you help me?
Thank you. It's a very nice question.
It's an example, not
It's
like,
an example, yes. So we'll have to do an assessment of this problem that you have come with, that you want to die, or you want to kill yourself. So we'll evaluate, yeah, is it just a thought? Is there a plan? And if you have a plan, do you already have the means of making this suicide happen? Yeah, so we'll do an evaluation, then our intervention will be guided by this evaluation.
So let's assume you're not a doctor now. You are my friend.
Yes. Okay, you are in the community there.
Yeah.
Maybe I'm a friend.
Yeah.
Maybe in the community also, the viewer knows somebody who has maybe been having thoughts of harming themselves or dying by suicide. So we normally talk of just applying what we call the 3 L's. Yeah, the 3 L's, it is look, listen, and link. So by looking, you look for any behaviors. Are there any change in behavior from what you previously know? By listening, you listen, is this person talking about harming themselves? And then by linking, now if you have looked and you have listened and there's something untoward, then you link them to a healthcare provider.
So I've shared all of this with you, but I don't want the help. I just want to die.
Thank you again for that. So we'll usually people are not the person who is sick or the person who wants to harm themselves. They are usually sometimes not aware that they need help. So it is those who are around them, their families. You can talk to their families. You can talk to their friends. In mental health, they are allowed to bring this person to hospital for care.
So just as we wrap up this conversation, can we give some guidelines to the community or anyone who is watching this episode on the measures of preventing suicide? Or suicide prevention tips? Yeah.
Suicide prevention tips, they could be many, but taking care of one's mental health is very important, because we have seen that mental illnesses are if we have mental illnesses, then we are at a high chance probably of reaching a point where we would want to die by suicide. Then creating awareness on suicide and the preventive measures, and also being observant. Yes, when we are out there in the community, being observant about our friends, our relatives, what they are talking about. Yes, then we link them appropriately to healthcare providers or a point where they can receive help, maybe not necessarily healthcare providers, sometimes even in the church, they can talk to a counselor. Yes.
Back to you. The world you want to see in suicide prevention.
The world I want to see in suicide prevention is a situation where mental wellness is taken seriously and mental health programs are also disseminated to the community, to the family, and into the society. And Dr. talked about disseminating mental health programs. This is going to go a long way in creating a society where suicide is openly discussed as a problem in mental health, as any other problem, where the community is aware that mental health can be treated, and people with suicidal ideations and attempts can also be treated and can come out of such thoughts. Society where there is a good support system in the clinical setup, a society where there is a good support system in the families and in the community, a society where we use our local and national media as a way of creating awareness on mental health and dying by suicide. A society where suicide is not criminalized. A society where suicide is seriously treated as an illness and a mental health problem. Yes.
Yeah, so according to me, the future of the community I want to see is a community where young people speak up and they get to share their problems so that they can be helped. Yeah, so that is all from this episode. I hope you got to learn something about suicide and suicide prevention. See you on the next episode. That is all from us. See you next time.
Thank you. Bye.
Thank you.